Next, let me discuss about the platinum compounds. Now, if you take this particular platinum compounds, the drugs include number 1 cisplatin, and next what we have is carboplatin, and the other drug what we have is oxaliplatin. Right, other drug what we have is oxaliplatin. So these are the platinum compounds. Remember, these are not alkylating agents. Alright, these are not alkylating agents. Okay, next. Now, these are not alkylating agents in true sense, but they are discussed under the topic of the alkylating agents because of the similar mechanism of action. Now, these drugs, they have similar mechanism of action. I'll tell you why. Now, if you take this particular alkylating agents, what we have discussed, the alkylating agents, they alkylate the DNA and they will cause the breakage of the DNA and they will kill the cell. Now, if you take these agents, what is the only difference is that is, now in the alkylating agents, the alkylation of the DNA was taking place and thereby there is killing of the DNA and killing of the cell. Whereas here, the platinum is used instead of the alkyl group to form the dimers of the DNA. Okay, so what is used here? Right, what is used here? The platinum is used, right, instead of the alkyl group. Right, the platinum is used instead of the alkyl group to form dimers of DNA. Right, to form dimers of DNA. Okay, so when this particular platinum is used instead of alkyl group to form the dimers of DNA, what this will do is the dimers of the DNA will cause the breakage of the DNA and will kill the cell, and thereby the actively replicating neoplastic cell dies, and thereby it is used in the treatment of the neoplasia. Now, you take the most common adverse effect associated with this particular the platinum compounds. The most common adverse effects of these agents is nausea and as well as vomiting. So, if you take the adverse effects, the most common is nausea and as well as vomiting. Right, nausea and as well as vomiting. Let me tell you an important multiple choice question here. As such, nausea and vomiting is associated with majority of the anti-cancer drugs, but the multiple choice question here is, among all the anti-cancer drugs, the maximum nausea and vomiting is seen with the platinum compounds, right? So maximum it is seen, so maximum of all anti-cancer drugs, right, of all anti-cancer drugs. Next, apart from nausea and vomiting, these drugs will cause mild bone marrow suppression, right? These drugs will also cause mild bone marrow suppression. And not only that, these drugs, they are nephrotoxic, they are ototoxic, and as well as the neurotoxic. Right, nephrotoxic, ototoxic, and as well as neurotoxic. Now, among these three, you take cisplatin, carboplatin, and as well as oxaliplatin. Remember, cisplatin is the one which is most nephrotoxic. Right, cisplatin is the one which is most nephrotoxic substance among these, whereas you take carboplatin. Carboplatin is more hematotoxic. Right, if you take carboplatin, this is more hematotoxic, right? Hematotoxic in the sense it is a bone marrow suppressant. Okay. Now, carboplatin, it is most of it is the hematotoxic, but it has less nephrotoxic and ototoxic and neurotoxic potential. Okay. So, carboplatin, it is less nephrotoxic, less ototoxic and less neurotoxic, right? Less nephrotoxic, ototoxic, neurotoxic compared to cisplatin, right? Compared to cisplatin. So, cisplatin, we have discussed that it is most nephrotoxic, whereas carboplatin is also nephrotoxic, ototoxic, neurotoxic, but it is less compared to that of the cisplatin. Now, you take this oxaliplatin, right? You take this oxaliplatin. Remember, oxaliplatin is effective against the cells showing resistance to cisplatin or carboplatin. So, where is the role of your oxaliplatin? Those cells which are having resistance to cisplatin and carboplatin, that is the place where we use this oxaliplatin. So, oxaliplatin is effective, right? It is effective against the cells which are, right, which are resistant to cisplatin and carboplatin. Right, cisplatin and carboplatin. Next, now let me tell you another important adverse effect here. Its dose limiting toxicity is the neurotoxicity, right? The adverse effect associated with the oxaliplatin is it will have what is called as the neurotoxicity. Right, it will have what is called as the neurotoxicity. And what is that particular neurotoxicity? It is nothing but your peripheral neuropathy. Right, it is nothing but your peripheral neuropathy. Next, before going into the further part of the discussion, let me shortly revise here what we have discussed. You take the platinum compounds. The platinum compounds, they include cisplatin, then we have carboplatin, and then oxaliplatin. These are not alkylating agents in the true sense, right? Only difference is that these use the platinum instead of alkyl group to form the dimers of the DNA. And the most common adverse effects, if you see, with these agents is nausea and vomiting. And this particular nausea and vomiting is maximum among all the anti-cancer drugs. And these drugs, they are mild bone marrow suppressants. And not only that, they are nephrotoxic, ototoxic as well as the neurotoxic. And you take the cisplatin. Cisplatin is the drug which is most nephrotoxic, whereas carboplatin, it is most hematotoxic, that is, it is a bone marrow suppressant. You take the carboplatin. Carboplatin, it is having less of nephrotoxicity, ototoxicity and neurotoxicity potential compared to that of the cisplatin, right? Compared to that of the cisplatin. Next, you take oxaliplatin. Oxaliplatin is effective against the cells showing resistance to cisplatin or carboplatin. And the other point is its dose limiting toxicity is the neurotoxicity, which is nothing but the peripheral neuropathy. So we have discussed that with the cisplatin therapy, it is associated with the nephrotoxicity. So what we have to do is, remember, it is important to establish what is called as the chloride diuresis, right? So before starting of your cisplatin therapy, like what you have to do is you have to establish the chloride diuresis. So remember, chloride diuresis is done, right? Chloride diuresis is done prior to cisplatin therapy. right, prior to cisplatin therapy. And what is the purpose of it? Mainly to prevent the renal toxicity. Right, mainly to prevent the renal toxicity. All right. Now, this chloride diuresis will only prevent the renal toxicity. But remember, the chloride diuresis has no effect on the ototoxicity. Right. This is a very, very important point. So, chloride diuresis has no effect on the ototoxicity. Right. It only reduces the nephrotoxicity. Next. The other important point, let me tell you regarding the cisplatin. Cisplatin, it is always given as a slow IV infusion. Right? It is always given as the slow intravenous infusion. Remember, it is never given bolus. Right? It is never given bolus. Now, what is the purpose of it to give it as a slow IV infusion? The point is, this is given in the form of slow IV infusion mainly to prevent the intense nausea and acute rise in the serum creatinine, right? So, this is given in the form of slow IV infusion to prevent the intense nausea and to prevent acute rise in the serum creatinine. Right, to prevent the intense nausea and acute increase in the serum creatinine. Now, there is one more, a very important interaction of this particular cisplatin. Now, what is that interaction is? You take the aluminium compound. Right, you take this substance, that is aluminium. If you take this aluminium, remember, aluminium, it inactivates the cisplatin. Right, aluminium, it inactivates the cisplatin. So, remember a point here, because aluminium inactivates the cisplatin, therefore aluminium containing equipments or aluminium containing needles should not be used with cisplatin. Okay, so remember a point here, aluminium containing equipments and as well as the aluminium containing needles should not be used along with the cisplatin. Right, what is the reason? The reason is the aluminium, it inactivates the cisplatin. Now, we have discussed that the cisplatin, it is associated with the nephrotoxicity. One way to reduce the nephrotoxicity is by doing the chloride diuresis. The other way to reduce the nephrotoxicity associated with the cisplatin by using a drug which is called as amifostin. Amifostin is labeled for reduction of cisplatin induced nephrotoxicity. Remember, this is a very, very important point, right? So, amifostin, right? Amifostin, it is the drug which is used for the reduction of, right, which is used for the reduction of cisplatin induced nephrotoxicity. Right, which is used to reduce the cisplatin induced nephrotoxicity. Now, let me tell you one more important point regarding the amifostin. Remember, amifostin is also used to reduce the xerostomia in patients undergoing irradiation of head and neck involving the parotid gland, right? Xerostomia is the dryness of mouth, right? So, this particular amifostin, the other use is mainly to reduce the xerostomia. Right, mainly to reduce the dry mouth, right? In which patients? In those patients, right, in those patients undergoing, right, undergoing irradiation of head and neck involving the parotid gland. Right, irradiation of head and neck involving the parotid gland. Next, you take this particular cisplatin. Remember, cisplatin, it has less chances of causing bone marrow suppression. Right, this is a very important point regarding this cisplatin. It has less chances of bone marrow suppression. Next, the other important adverse effect is cisplatin reduces all the ions in the serum, right? Cisplatin, it reduces all the ions. Now, if you take the ions, remember the cisplatin will cause hypomagnesemia, right? Cisplatin will also cause hypokalemia. Other important thing is the cisplatin will cause hypocalcemia. Cisplatin will also cause hypophosphatemia. Right? Cisplatin, it will reduce all the ions, that is hypomagnesemia, hypokalemia, hypocalcemia and hypophosphatemia. Remember, we have a drug called cyclosporin. Cyclosporin, it is an immunosuppressive drug that causes hyperkalemia. Right? Very important point here. Cisplatin is the drug which will cause hypokalemia. An important multiple choice question here is, we have a drug called cyclosporin. Cyclosporin is also an immunosuppressive drug. Cyclosporin is the drug which will cause hyperkalemia, that is, it increases the potassium levels. Right? It increases the potassium levels. Next, let me tell you another very important point. Cisplatin has been associated with the development of acute myeloid leukemia, usually 4 years or more after the treatment. Right? The other important adverse effect associated with the cisplatin is, it is associated with the development of, right, it is associated with the development of what is called as acute myeloid leukemia, usually 4 years or more after the treatment. Right? So let me shortly revise here. Remember, this cisplatin is associated with the renal toxicity. So what you have to do is, you have to do chloride diuresis prior to cisplatin therapy, mainly to prevent the renal toxicity. And this chloride diuresis has no effect on the ototoxicity. And cisplatin is always given in the form of slow intravenous infusion but never bolus. And what is the purpose is mainly to prevent the intense nausea and acute rise in the serum creatinine. Now, you have a substance or you have an ion which is called as aluminium. Aluminium, it inactivates the cisplatin. Therefore, aluminium containing equipments or aluminium containing needles should not be used with the cisplatin. Next, we have a substance which is called as amifostin. Amifostin is labeled for the reduction of the cisplatin induced nephrotoxicity. And if you take the other drug, that is amifostin other use, amifostin is also used to reduce xerostomia in patients undergoing irradiation of head and neck involving the parotid gland. And cisplatin has less chance of causing bone marrow suppression. And remember, the cisplatin, it reduces all the ions in the serum, that is, it will cause hypomagnesemia, hypokalemia, hypocalcemia and as well as hypophosphatemia. And remember, we have a immunosuppressive drug which is called as cyclosporin. This particular drug causes hyperkalemia. And cisplatin, it has been associated with the development of acute myeloid leukemia, usually 4 years or more after the treatment.